Hi, I'm Hope Witkowsky. On today's episode of Senior Scene, we're going to be talking about strokes. You'll learn all the symptoms and why it's important to react quickly, because time lost is brain lost.
A stroke is technically a cerebrovascular accident. And what it is we have blood vessels going all over our body, and the blood vessels going to the head carry the blood with oxygen to the brain. A stroke is when there's an impediment or a closure of one of the vessels. You don't get the blood and oxygen to the brain, and within minutes you start damaging the brain. It's irreversible, and a stroke occurs. A stroke is then has a residual that from the part of the brain it affects. It may affect your arms, your legs, your speech, but that's the damage from a stroke. It can happen from a clot. A clot can come from any place in your body, go into the artery, but the most common in people my age and older than that is arteriosclerosis. You build up blockages in the artery, and then suddenly one of the arteries can form a clot right at the area, close off the artery, and then you have a stroke.
What happens if the person has some of these things happen to them? What should they be looking at, and what about the timing of getting help?
Well, that's critical, and it's a great question. A stroke, I'll give you some signs, but if you think you're having a stroke, timing's critical, and time is brain. The more minutes that you have the stroke and don't do something about it, don't restore the blood, the more damage there will be to your brain. And the brain's unforgiving, very hard to sort of regenerate. So the second you think, even if you have the suspicion that it's occurring, you call 911 and get to the emergency room, because there are ways to sort of rejuvenate and get the blood going to the heart. There's ways with intravenous medicine. At Torrance we have a procedure the radiologist can go up and actually take the clot out. So it's within minutes you have to identify it. And the more you wait, in fact within 3 to 4 hours, if you've waited that long, the procedures probably aren't going to be beneficial.
What are some general symptoms? You're sitting there watching television and then something happens and you don't kind of feel right, but what can you kind of pinpoint some of those symptoms of, hey, maybe this is a stroke, and so I better be calling 911?
Sure. Some of them are pretty obvious. You'll get numbing, tingling, or weakness, especially on one side of the body, arm and leg. Your face may get numb and you can't move your lips. You'll have an effect with your speech. It could start slurring. Visual loss is important, usually one-sided. It's not usually a loss of consciousness. It's everything else. It's localized. And those are the things that if you have you might lose your memory suddenly and just be sort of vague. You may have a speech defect or slurred speech or any of these weaknesses. Those are the most common.
And stroke prevention is the same as heart disease prevention.
If you have a heart attack and you have blockage there, there's a good likelihood you could have a stroke because it's the same process. And people who have strokes have heart attacks. It's all the same. And you usually have a combination. If you have plaques in your heart, they're sort of like cockroaches. They're all over your body. So to prevent it, you do the same thing you've heard in the paper and everything to prevent a heart attack. One is you want lifestyle's critical. That's as close as you get to holistic. And you don't have to live like Gandhi. You don't have to be a vegan, although you can. The main thing is keeping your cholesterol low. You don't necessarily need medicine. Keeping your blood pressure under control. And the basic is under 140 and under 89. You can go lower, but that's where you start. You want your weight, with obesity, building up, the weight getting down to at least a normal body mass index. You can't smoke. Smoking is the thing that affects everything. Whether it be your lungs, your blood vessels, but that's critical. Diabetes itself, it's a product of obesity, it's a product of poor lifestyle, but that itself is a big risk. If you can handle those, and there's a cholesterol test called the ApoB or non-HDL cholesterol, if you can get those under control, you've really beaten things without having to talk to your doctor 4 times a year, without having to get more blood tests and taking medicines.
Strokes are preventable if you know some important facts about your health. The first is to know your family health history. Did a relative have a stroke? This may be hereditary. If you are over 55 years old, then your risk factor moves up. Keeping your blood pressure at or under 120/80 can also help. Next, eating healthy foods and keep your cholesterol low. Cigarette smoking and even secondhand smoke are also big contributors. Being overweight with a body mass index over 25 or having diabetes and a lack of regular physical activity brings the risk of a stroke even higher.
Once you have those symptoms, get in there as fast as you can. Don't be afraid to call 911. And that's the biggest thing. People, they actually teach in the American Heart Association for the partner and the friend to notice it. Because for one, you may be a little disabled, but second, we're all in denial. I mean, we just don't face it. So somebody may have to say, hey, you're having a problem, we're getting you in. And that's what 911's for.
If you or a loved one has a stroke, there is hope for a partial recovery if you act fast and get medical help. Frederick Burchell knows this from his own experience. Frederick, I understand that you are a stroke survivor. Tell the viewing audience what it was like when you first started having a stroke. What did it feel like?
Well, I was actually in bed at the time, but then I got up to go to the restroom and I just fell over. And I realised then that I'd had a stroke. What it felt like, I don't really know what it felt like. It just felt as though I just couldn't move. So I crawled to the telephone and phoned 911.
Now that you are a survivor of the stroke, what were some of the things that the stroke had left you with? What is your, if you want to call them, your challenges in movement?
Well, my challenge is my right hand, my right arm was useless, and so was my right leg. And until I started therapy, I was in a wheelchair for quite a while. And then I gradually got out of the wheelchair to walk. And I was at a little company in Mary up on St. Pedro, there. And then they transferred me to here.
It looks like you're really living a kind of almost a normal life. What do you do here now that you're at this stroke center?
Well, she just concentrates on my arm and tries to get my arm going properly. I've already had the physical therapy, which I passed out with. That was with my right leg, so that became okay, well, more or less okay. And then the occupational therapy was to try and get my arm working.
Over a year now, what do you see the difference of when you had the stroke to how you're able to get around and move your right hand and all that? How would you say that this therapy is working for you right now?
Well, I can get around okay, and my right arm is quite good. I do play golf where I live, but then I started playing one-handed, and now I'm playing two-handed. Not very good now, but I get along very well, actually.
Torrance Memorial Medical Center is the only hospital in the city of Torrance awarded the Joint Commission Certificate of Distinction as a primary stroke center. At Torrance Memorial, a highly coordinated, specially trained team of paramedics, emergency physicians, neurologists, radiologists, nurses, and pharmacists work together to provide fast, effective treatment within that first crucial golden hour a patient arrives at the hospital doors. What are some of the stories that you can talk about of patients that have come in here that you've seen improvement on?
Well, stroke, as you can see, is a very scary ordeal. Patients don't know what's happening to them. They don't know what's going to happen to them and how everything works. So I'm very lucky to be in this position to be able to help them walk through this position. We just had a patient the other day that could not move their right side completely paralyzed on that side. Was very scared. The family was very nervous. And so we were able to help them walk through this process. We were able to give them the medication they needed because they came in at the right time. And within about 3 or 4 days, we see them walking out the hospital doors.
Torrance is very lucky to have Torrance Memorial Medical Center. From their patient care to the neurologist doing the scans to determine your prognosis, you can be sure that you're in good hands. So today we've learned all about strokes and why it's important to take action promptly, because this can lessen the side effects later on. I'm Hope Witkowsky, reminding you that knowledge is a powerful tool. Tune in next time for more secrets on successful aging.